Hi there, I'm Dr. Jesse Morse and I am a sports medicine physician at the Osteopathic Center in Miami. So let's talk a little bit about elbow injuries, which ones are common, and exactly how to treat them. So the most common elbow injury is actually tennis elbow or lateral epicondylitis. This is on the top part, on the outside of the bone, and it's really where the tendon inserts into the bone. This is the same muscle that if you were to pretend like you're revving up a motorcycle, you'd get the same muscle. And if you raise your middle finger, if you have this pain, that will make that pain worse. That's because that's the same tendon that attaches to it. Very common injury, very frustrating injury. If it's not calming down with a little bit of bracing, a little bit of icing, or physical therapy, sometimes you have to put some medicine in there. This is not a common surgical procedure unless it's fully torn off, because it's not something that's easily fixed surgically. So traditionally, there are a couple options. You can do steroid injection, or you can do regenerative medicine options. Steroids will help the pain, but unfortunately they don't last more than 30, maybe 45 days if you're lucky. That's what all the data shows. And at about a year's time, it's like they never got an injection. If you want to fix the tissue and structurally change it, that's when you can use some of the regenerative medicine products, whether it's prolotherapy or PRP. You can try stem cell, or you can try any of the higher level stuff like the amniotic tissue allografting. Any of those will be very effective in decreasing the inflammation and helping that tissue get back to relative normal. Will never be perfect. If you go to the other part of the elbow, on the bottom part, that's what we call golfer's elbow. We see it in a bunch of different sports. You don't have to be a golfer, but the motion of kind of flicking the wrist can irritate that tendon. This is where the tendons from the bottom part of the forearm attach into the bone. The treatment options are essentially the same as lateral epicondylitis, but they're about half as common. So twice as many people get lateral epicondylitis than medial epicondylitis. Medial epicondylitis is frustrating, but thankfully not very common, and most patients do quite well, or conservatively. If they don't, that's when they usually come see us to finally put the nail in the coffin and just move on and get it actually treated, and you don't got to worry about it anymore. Elbow fractures are much more common in younger, in the pediatric athlete, in younger patients, whether they're playing and fall off the monkey bars, or they accidentally land and their elbows out, or they, maybe mom was holding them trying to cross the street, or dad, and they pulled their arm real quick and their elbow pulls out of their socket, so to speak. That's what we call a nursemaid's elbow. So those aren't super common as we get older. In the adolescent or pediatric age, much more common. The fractures usually heal quite well, assuming that they are perfectly lined up. If the fracture is complicated, sometimes then their surgery is required, but most of the times certain types of bracing, certain types of casting do really well for elbow fractures. Now let's talk about something not very common, but asked about often. There's two things I want to cover here. One is an acute infection or inflammatory response in the elbow, and the second one is arthritis of the elbow. So the first part of this would be gout, or what we call pseudogout. I've had a couple patients in my career come in and literally their arm was like this. They are miserable. They can't extend their elbow even if you want them to. They are writhing in pain. It just happened. They didn't fall, they didn't do anything, and they say, I'm miserable, I just want to chop off my arm, I'm so much in pain. This is usually an acute gout attack. Gout is a crystal that has a tendency to form in joints, most commonly in the big toe, but you can get it in several different joints, and it loves to affect some of a joint like the elbow, and it just wreaks havoc on that elbow. The cousin of gout is what we call pseudogout, which is a different type of crystal, not as common, but it's actually quite common down here in southern Florida, or in Florida in general. We think maybe it has to do with the humidity, but there's really not a good explanation for it. It presents very similarly, but we don't have as many preventative meds for it like we do with gout. The last part, or the last issue with elbow injuries is arthritis. Arthritis is not very common in the elbow, but if you've had an injury to your elbow in the past, if you've broken your elbow or fractured your arm at where it inserts into the elbow, you can have arthritis. The elbow is essentially a joint that moves like this, and there should be cartilage in between those two. If the cartilage is beat up and worn down, then unfortunately the two bones start to rub, the arthritis starts to develop, and you start to see a lot of swelling, a lot of pain, inflammation. You may have some catching and clicking or locking, and that can happen and be very uncomfortable. So that's when you have to decide, can you do a steroid injection? Do you want to put maybe a unique product in there, one of the Regen or something called A2M? Or we can consider something like surgery or doing a small surgery where you go in and clean out that joint, remove some of the little bone spurs that are kind of sticking around, causing it to not flow correctly. And at that point, you can give them some benefit. If the joint is just completely destroyed, you can replace this joint. Not super common, but it is a possibility depending on how bad it is and what the patient's options, what they've tried and whatnot. But to give you an idea, those are the most common elbow injuries, with the lateral epicondylitis, tennis elbow being the most common, and then throwing in a little bit of golfer's elbow, adding in a little bit of gout or intermittent fractures if someone happens to fall, and then you can have the rare arthritis that can happen, but just not very common. If you have any questions, I'd love to hear your comments below. If you would love a consult, either you're close by at one of our offices, either here in Miami, up in Tennessee at our Knoxville office, or in Jupiter, which is kind of near West Palm Beach. If you want a consultation, you let us know. If you want to do a virtual consultation and say, I would love to hear their thoughts, but I'm not physically there, we also have the ability to do those. Just reach out to us at the office and let us know. Hope you learned something. Thanks for tuning in. Check out some of our other videos. Take care.